Hello friends, this is Shubham and today I'm going to talk about cholinergic antagonists or anticholinergics. Cholinergic antagonists are those drugs which actually blocks the cholinergic receptor. So that's why we also call them as cholinoblockers. Now, cholinergic antagonists are divided into antimuscarinics and antinicotinic. Antimuscarinics are further divided into non-selective antimuscarinics and selective antimuscarinics. Now, in non-selective antimuscarinics, we have drugs like atropine, scopolamine, which is also called as hyoscine. We'll talk about them later on. And in selective antimuscarinics, they are actually M1 selective and they could be M3 selective. M1 receptor selective and M3 receptor selective. M1 selective, we have famous drug pyrazapine, which is M1 antagonist, also used for peptic ulcers. We will talk about them. And M3 selective, also a famous drug, darifenacin. Actually, it's used for the overreactive bladder. We have some also other drugs like sulfenacin or oxybutynin, trospium. We will talk about them. But if we talk about the antinicotinic, they are further divided into neuroneuronal and neuromuscular, neuroneuronal or neuroeffector side. Now, neuroneuronal, they are divided into, or the category which comes under it is ganglion blockers. Ganglion blockers. And in neuromuscular, we have simply neuromuscular blockers. So this is the very basic classification of cholinergic antagonists. Now let's talk about these drugs one by one. Let me rub this. And let's talk about the atropine first, which I'm sure you must have heard about this drug, very popular drug, atropine. So let's talk about atropine. Atropine is actually a plant derivative. It is derived from the Atropa belladonna. Its duration of action is approximately 3 to 4 hours if applied systemically, and it can last for fewer days also if it's applied topically. So that's why we have some drugs which have shorter duration of action but have similar mechanism of action as atropine. So let's talk about those drugs. These drugs are hometropin, cyclopentolate, tropicamide. So these are the drugs which can be used instead of atropine because they won't cause blurring of the vision for much longer time. Because usually in atropine, as I told you that it can last for fewer days, so in the patient there is a complaint of the blurring of the vision last for fewer days. So nowadays we are using the drugs like hometropin, cyclopentolate and tropicamide. These have usually shorter duration of action. If we talk about the tropicamide, it have the duration of action about half an hour, 30 minutes to 1 hour. Now, if we talk about the pharmacological actions about the atropine, it causes mydriasis, which is also called as pupillar dilation. Actually, it causes the dilation of our pupil as far as our eyes are concerned. Now, due to the pupillar dilation, there is a complaint in the patients of photophobia because as the pupil will dilate much, more and more light will enter into the eyes. So there is the complaint in the pupils who are using the atropine. They have the complaint of photophobia. Because they won't like much light entering into their eyes. Second one, the main pharmacological effect as far as eyes are concerned, which is cycloplegia. Now what is cycloplegia? Actually it is the paralysis of the ciliaris muscle until the effect of the atropine. So it is the paralysis of the ciliaris muscle. Now it causes the blurring of the vision or blurred vision. Okay, so these were the pharmacological actions as far as our eyes are concerned of atropine. Now let's talk about the lungs, what it will do in lungs. In lungs, usually there is some physiological bronchoconstriction in our lungs, but if we talk about the cholinergic antagonist, for example atropine, it would cause somewhat bronchodilation. And we have very famous drug for that, that is ipratropium bromide. We can use that drug in COPDs, which are chronic obstructive pulmonary disease, and asthma. Now if we talk about lungs, what it will cause bronchodilation. Now let's talk about the heart, what it will do with the heart. Actually, it accelerates the heart rate by blocking the M2 receptors present on the heart, for example on SA node or AV node. So, about the heart, it will cause tachycardia. Now, if we talk about the GIT, which is gastrointestinal tract, what will we do over there? Actually, it has antispasmodic activity over there. Antispasmodic activity, which is very clear, which is against the contraction, because most of the cholinergic drugs, they actually stimulates the contraction of the bowels, but as far as cholinergic antagonists are concerned, they are just opposite as cholinergic agonists. So they would cause the antispasmodic activity over there. Now, they will cause the antispasmodic activity. Also, as far as urinary bladder is concerned, they will cause the antidetrusor muscle activity. Antidetrusor muscle activity. Now, actually, they are the detrusor muscles present in the urinary bladder, which helps us in the urination. What they will do? They will cause the stasis of the urine and will not allow the urine to pass out of the body. We have one drug which acts over here, that is M3 antagonist, as I already told you, diphenocin, which cause such kind of activity like antidetrusor muscle activity. And we have one more drug which is causing the antispasmodic activity. However, atropine is doing the same action, but there is a drug which will be used in peptic ulcer, or which are using nowadays in peptic ulcers. What it will do, it actually not allow the secretion of acid in our stomach, which is the HCl. So there is a drug. Actually, this one is the M1 antagonist, which is pyrazapine. So these are the activities as far as GIT is concerned for the atropine. Now let's talk about the salivatory glands, sweating glands, or smooth muscle glands, what the atropine is doing over there. So let's talk about the salivatory or lacrimatory glands or sweating glands. Salivatory, sweating, or lacrimatory glands. Lacrimatory glands. So let's talk about the activity of the atropine over there. As far as salivation is concerned, there will be no salivation because of the blocking of the cholinergic receptors over there. So there will be dry mouth, which is xerostomia. There will be dry eyes as far as lacrimation is concerned, which means xerophthalmia. Also, there will be no sweating as far as sweating glands are concerned. Now, imagine if the person is not sweating. If the person wants sweat, then the body temperature would be elevated. Now, the body temperature would be elevated, so it means the body is not able to get rid of the heat. So, due to compensatory reactions in our body, the body temperature would be elevated, due to which the redness of the body will occur. So, there will be no sweating, so which leads to actually higher temperature, which will lead to redness of the body. So no sweating, which is also known as anhidrosis, the body's inability to sweat or get rid of heat. So these are the effects of atropine over the salivatory, sweating, or lacrimatory glands. Now, let's talk about some uses of atropine or some indications of atropine, that where this atropine is using. Let's talk about the indications of atropine. Yes. So let's talk about the indications. First of all, it is used for the retinoscopy. If the ophthalmologist wants to study the retina of the person, so they would use the atropine for the pupillar dilation. So it would be much more better for them to look over the retina. So it is used for the retinoscopy. It is used for the iridocyclitis, which is the inflammation of iris as well as ciliaris muscles. It is used for the keratitis, which is the inflammation of cornea, and it is used for the refractive errors of the eye. Refractive errors of the eye. Because in all these cases, pupillar dilation will help to study over the retina. And if we talk about the iridocyclitis, the ophthalmologist would find more easier to look over them. And about the refractive errors, the same thing applies. Now, there is one drug which causes the mydriasis, which is pupillar dilation, but doesn't cause cycloplegia. Actually, in elder people, this drug will help, because in elder people, the lens doesn't move much, so they don't need to interfere with the lens activity or the ciliaris activity. So there is a drug which is alpha-1 adrenergic agonist, and the drug name is phenylephrine. Now what the drug will do, it will cause the pupillar dilation, that is mydriasis, but doesn't cause the cycloplegia, which is the paralysis of the ciliaris muscle. So this one is more useful in the elder patients. This is alpha-1 adrenergic agonist. In some exams, they can ask you about this drug. Most usually useful in their elder patients or who have aged above 40 years. Now, but remember that we can't use this drug, that is atropine, in narrow angle glaucoma, because further it will cause more closure of the angle of the glaucoma. So we can't use this drug if we talk about the contraindication. We can't use this drug in narrow angle glaucoma or wide angle glaucoma also, but more specifically the narrow angle glaucoma, because it would cause much further complications over there. So ophthalmologist usually make sure that the patient is not suffering from any kind of glaucoma, more specifically the narrow angle glaucoma, because it would cause much more complications rather than relieving of the patient. Now we've talked about the pharmacological actions of the atropine, we've talked about the indications, uses, we talk about the contraindications. Now let's talk about the toxicity of this drug, atropine, that what could happen the patient if there will be overdoses of the atropine. So now let's talk about the toxicity of atropine. Toxicity. Now, the person would feel like the blind as bad because, as I already told you, that there would be cycloplegia with these kind of drugs, that is atropine. So, due to cycloplegia, it will cause the blurring of the vision. So, due to blurring of the vision, the person will feel like as blind as bat. Further, the person will feel like dry as bone. We give the term as dry as bone because there will be no sweating. So the person would be dry, there will be no sweating, and due to which the person would be as hot as hair. Why? Because as there will be no sweating, which would lead to the elevation of the temperature inside the body, so the person would be much hot, so that's why hot as hair. Further, as there will be the elevation of the temperature, so which would cause the redness of the body, so more obviously red as beet. And some people also give this term to atropine as mad as haters. Because in recent times or in older times, when the person which used to make hats, they used some kind of glue to make the hats. Actually, those glues had the properties somewhat like atropine, so they had the problems with the cholinergic system. So that's why, and they showed the similar symptoms as the toxicity of the atropine. So that's why some people call it as also as mad as haters. Now we talked about the toxicity too. Now let's move further and let's talk about other drug which is also non-selective, which is scopolamine, or the other name of scopolamine is iocin. Now let's talk about scopolamine. Which is also called as iocin. Now, this drug is usually used as a transdermal patch. It's usually coming as a transdermal patch, which is usually applied behind our ear or the mustard process. Now, what it will do? It is used for let's talk about the uses. It's used for the motion sickness, which is the disturbance of vestibulocochlear nerve. Vestibular nerve for the balance and cochlear nerve for the hearing. So it is the disturbance of both the nerves, which is vestibulocochlear nerve, 8th nerve. Now, if it is given prior to these symptoms like nausea, vomiting, which are much more obvious in motion sickness, so if you give this drug prior to motion sickness, then it would be more effective. So more effective when given prior to motion sickness. And also, as I told you, it is also comes in transdermal patch, which applied behind the ear. Applied behind the ear. So this is the indication for the scopolamine or hyoscine. Again, if you talk about the toxicity, there will be the same toxicity, which will be anticholinergic effect, or there will be the interfere with the parasympathetic activity. Now, let's talk about some words about ipratropium and tiotropium. Actually, ipratropium has shorter duration of action, and tiotropium have longer duration of action. So, ipratropium has shorter duration of action, and tiotropium has longer duration of action. Now, actually, these drugs are, ipratropium is quaternary ammonium structure. It is quaternary ammonium structure, that's why it can't penetrate the biological membrane. It's quaternary ammonium structure, it can't penetrate the biological membranes as far as ipratropium is concerned. And it is coming in an inhalational form, used as inhalational form. And what is the purpose of using this? As I already told you, they are used in COPDs, chronic obstructive pulmonary diseases, and asthma, because it causes bronchodilation. So these were some words, these were some talkings about the ipratropium and tiotropium. These are the similar actions. Now let's talk about those drugs, those anticholinergic drugs actually, which we used in Parkinson disease along with levodopa. Because what happened in Parkinson disease, there is a much amount of the dopamine. Actually, there will be here is the dopamine, and here is the acetylcholine. So the dopamine amount is less as far as Parkinson's disease is concerned, and the acetylcholine amount is more. That's why these kind of people have Parkinson's disease. Now the drugs, the anticholinergic drugs, which we used in Parkinson's disease along with levodopa, these are drugs as benztropine, trihexyphenidyl, and biparidine. Because in some exams they can ask about the anticholinergic drugs which are using along with the levodopa in case of Parkinson's disease. So these are the drugs which we used in Parkinson's disease. Now there are some other drugs which we used in overreactive bladder, which are actually M3 antagonists. As I already mentioned some of them, let's talk about them. But what drugs we can use as far as cholinergic antagonists are concerned in case of overreactive bladder. So, overreactive bladder. Overreactive bladder. Drugs. So what drugs can we use for the overactive bladder or the urination problems which will cause the stasis of urine as far as these drugs are concerned? So these drugs are dariphenacin, as I already mentioned, solifenacin, oxybutynin, trospium, and trotaridone and physotieridone. So these are some drugs which we can use in overactive bladder conditions. Now after talking about these things, let's talk about the adverse effects of anticholinergic drugs. So let's move on to the adverse effects. Actually, there is very simple mnemonics which could be helpful in remembering those adverse effects of the anticholinergic. Like I told you in the cholinergic agonist video also, there was the mnemonic, the jumble, which we used to remember, which can be very helpful in remembering the cholinergic agonist adverse effects. But as far as cholinergic antagonist adverse effects are concerned, adverse effects of cholinergic antagonist, adverse effects. This can also be remembered very easily with the help of mnemonic. We have simple mnemonic as A, B, C, D's. That's it. Now what is A? A is actually agitation, which can be clearly seen in these patients. Now if we talk about the agitation, there will be C, which will be constipation and confusion. Now B, the person would feel like as blind, so we can use it as B, the person would feel like somewhat about blind because of blurring of the vision, cycloplegia. D, dry mouth, dry eyes, and the person would be dry, no sweating, xerophthalmia, xerostomia, so the person is gonna feel about the dry mouth, dry eyes, very obvious adverse effect. And for S, it's stasis of urine and stasis of sweating, because there would be no sweating in such kind of patients. So these were the adverse effects of adrenergic antagonist, and we almost talk about the antimuscarinics. In my next video, I will talk about the anticholinergics, that what will be the side effects, what will be the usage indications, contraindications, and all those things. So till then, take care, see you in my next video. Thank you for watching this video.